I met Mike January 2016 at Southland Leisure Center when I joined the TrueNTH exercise program, which has now morphed into ACE, Alberta Cancer Exercise, and I know they're still running some other studies, and Mike's going to share that information. Mike Dew is a certified exercise physiologist. Has your 2-year-old son figured out your title yet, Mike?
My 65-year-old dad doesn't know my title.
No, exactly. Mike is with the Health and Wellness Lab and works as a project coordinator for the TrueNTH Lifestyle Management Initiative. That initiative provides wellness programming to prostate cancer survivors across Canada through community and online programs, and I had the privilege of doing one of the videos, so if you go onto that website, you'll track me down doing some weights at the Thrive Center with Mike one day. He also gives testing support for many other projects in the Health and Wellness Lab, and I know he's also helping out different instructors. I've had him out at the Prostate Cancer Center exercise program, subbing in for one of the instructors. He knows his stuff, and he knows how to work us. So away from work, he enjoys time with his wife and his wonderful 2-year-old son, and stays active by playing recreational hockey. So Mike, it's up to you now to give us an update on how physical activity programming for men within prostate cancer has progressed throughout Canada. Welcome.
Thank you, Dave and Brad, for having me here today, and thank you everybody for tolerating a lovely night inside. I promise not to keep you here for too long. As was introduced, today I'm going to be talking about everybody's favorite topic that you get to be lectured on a regular basis. That's about how to be active and how to stay healthy. Today is going to be a little bit different than what you're likely used to. I am not a motivational speaker. I'm not here to get you rah-rah. I'm not here to make you feel guilty if you want to sit on your butt for a little bit, enjoy a beer, enjoy a glass of wine. You do you. I'm doing the same thing, guaranteed. What I'm here today to do is to show you the options available to you and how far we've come, because it's actually an exciting time where there's different options, more options than there's ever been before for all of you. Does that mean that there's less and less excuses for not getting active? Yes, but we still want you to get to that place on your own, doing something that you enjoy. So hopefully after tonight, I will have convinced you to at least think about it and see where it goes from there. So we will start off with a little bit of a background on what being active can do for you and can do for anybody, regardless of what age you are, regardless of the background. As a part of that, we're going to go through what TrueNTH, yes, TrueNTH does stand for TrueNTH, what it looks like, how it's been progressed, and how it's looking in the future. And we're also going to look at exactly what we found in the first 3 years of it, because your group was a large reason behind a lot of the outcomes that we found, because everything was ground zero here. TrueNTH is a national initiative. It's going on in cities across Canada, but it all started right here, mostly with all of you in this room. You likely know somebody who took advantage of the program and helped launch it to other areas around the country. So exercise, or as I like to say, physical activity, because exercise can be a scary word for a lot of people. It's the eye roll word. It is safe and beneficial at any stage of the cancer experience. That goes for almost every tumor group, that goes for almost any treatment you've received, whether you've received treatment, whether you're after you've received treatment, and all the way throughout the rest of your life. And every year, the limits for what you're capable of doing that the research shows are just going up and up and up. So we progressed from a point about 15 years ago where as soon as you were diagnosed with prostate cancer, the very first words out of the doc's mouth were rest. Don't do anything, rest. We don't want you pushing it in any way, shape, or form. And now it's getting to the point where, let's say you've had surgery, you've had several weeks to recover over that. We are now at the point where people are telling you to get going. Get back at it, do what you enjoy, and there's nothing wrong with that. You're going to be safe. And when we talk about safety, we can take a look at somebody who's very high risk, has a lot of other issues going on, but as long as everything's done properly, you're still in great hands and you'll still get all the benefits that you would otherwise. So exercise, besides being safe and feasible, you are going to get some actual concrete physical and emotional benefits from it. So you're going to have an increase in your physical functioning, a decrease in your fatigue. As it stands right now, it's really the only way we know to get over treatment-related fatigue, mostly associated with ADT or chemo. There's really no pill that can unfortunately counteract that major symptom. Exercise is the only thing. I understand, most people understand that's a little bit of a catch-22, because if you're feeling like you don't want to get out of bed, then you're not going to get out of bed and go for a walk. So it's being able to take those little baby steps, being able to do something rather than nothing, and then slowly bringing yourself back and listening to your body as you go. After treatment, it's essential for recovery and fitness, because after treatment, you likely have been a little bit sedentary. It's taken a toll on your body, and one of the best ways to get back to where you want to be is to get up and find a treatment plan or a recovery plan that involves some sort of activity. And we also want to make sure that everything is individualized. Just like everybody here experiences the diagnosis differently, not one single person is the same, neither is going to be the exercise. We can exercise in groups together, but there's always going to be modifications that are going to be specific for you, preferences that are specific for you, and that's totally okay. It's not a scenario that you see typically that a lot of people have the stereotypes with the gym, where, well, if Joe Bicep over there is doing 30-pound squats and I need to be doing 30-pound squats too. Not the case. You do what you want to do. You do what is going to be comfortable for you. And we want to make sure that there's always the resources available so that you feel comfortable with that. So Nicole, my supervisor, wanted to start out with a testimonial. You guys will probably, most of you will know this individual. Some of you might be like, I've heard enough of this individual. But our dear friend Colin Cantley is going to tell you exactly how everything went for him, and you might recognize a few other people in this video as well. So no audio. I'm not going to try to transcribe it to you either. So basically what we had Colin do is we were looking for some sort of testimonial that we could use to introduce the benefits of physical activity to your peers throughout the country. So he was nice enough to offer his services to do a little video focus on his story, not just his challenges in regards to cancer, but all the other challenges that are associated with aging, with life in general, and addressing a lot of those barriers that you typically see to actually get active and have a high quality of life. And what we've been able to do with this video is exactly what I just mentioned, is we've been able to post it online and sending it directly as well to cancer clinics in different parts of Canada. And it has served as a little bit of an eye-opener to even healthcare professionals, to really reiterate to them that this is something that is beneficial to their patients and something that might help with improving the amount of follow-up that they have to do and the amount of care that they have to provide after the bat. There's your, yeah, I'm sure autographs are available later on after I'm done. But it's been a really important aspect to have the multimedia involved. One of the most challenging things that I've had to do over the now 4 years of TrueNTH is being able to bridge the gap between the needs of prostate cancer survivors with administrators and professionals who are not the same age of you and have much different interests and much different values in a lot of cases as well. And so even though multimedia is something that we're not always all the way comfortable with, these sorts of things have proven to be a wonderful little bridge to be able to bring about an idea of what you and your peers need compared to what is offered out there right now. So as was alluded to before, in Alberta there's many different programs that you can take advantage of now that are prostate cancer or cancer and exercise related. The project that I do is still TrueNTH Lifestyle Management, and we'll get to the other programs available as well later on in the presentation. But we wanted to give you a little bit of a sense and bring you back to the very beginning of this project 4 years ago and show you where we've come and where we're going from now. So as a quick synopsis for some of you who have never heard about it before or have decided it really just wasn't that important and you moved on with your life, TrueNTH Lifestyle Management is a nationwide initiative funded by Movember and Prostate Cancer Canada. And as soon as we got Movember money, we met, and Nicole was very clear that she wanted to make sure that those funds were still going to be able to affect local initiatives. Knowing that there is a lot of times a disconnect when you deal with a large funding agency like that, you're not sure exactly where your dollars are being funneled. We wanted to make sure this was a grassroots initiative. So what we're able to do is take the 10+ years of research that had been done with physical activity and exercise and prostate cancer, and we tried to take all those protocols done in very controlled settings that are very boring and try to apply it to a real-world setting with activities that all of you would find to be beneficial, enjoyable, fun, gonna have some giggles during it as well. And so we were able to bring about what we called champions, which are basically researchers and clinicians who are experts in physical activity, nutrition, cancer care, and stress reduction. And when we brought all those minds together, we were able to put together the infrastructure involved with actually putting the program into place. Along with that, on that local side that I mentioned, we wanted to bring in regional champions, so people who could actually deliver the program locally, knowing that as a team based in Calgary, we weren't going to be able to do the work necessary in other cities as well, since we're not hands-on. So during the program, we were able to start piloting, as I mentioned here, in Calgary at the U of C, and then as well in Halifax, and we started to expand from there. In Calgary, we quickly transitioned from the pilot at the U of C into an actual community-based setting, which was our intention the whole way, was to make sure that programming wasn't centered all the time at universities or at clinics. It was in locations most convenient to all of you and locations that you would probably enjoy the most as well. So we were able to partner with the City of Calgary to deliver the programs at their facilities, and that continues to this day with ACE. In addition to the community programs, we wanted to make sure that when you attended a class, that you felt very comfortable and at ease the whole time. So we went about making sure that we were training all the professionals that were facilitating the programs. And then along with that, we wanted to make sure that these programs were going to be sustainable and feasible for a long time. And so we went about trying to advocate the healthcare system so that newly diagnosed men would be able to be told about their options right away and join them. The other thing we discovered during the 3 years that I'll get into in a little bit is that advocating for all of you means also giving some repeated kicks to the butt once in a while. Knowing that everybody's experience and perception is a little bit different, and what we're seeing is that a prostate cancer survivor is quite different than the typical cancer survivor that a lot of the models that the healthcare system is based on for advocacy deliver currently. Finally, we wanted to make sure that there's as many options for survivors as possible. So on top of the community programs, if that wasn't somebody's cup of tea, whether you just really don't like people, or whether you lived in an area where you couldn't easily get to a community program, we wanted to make sure there was a home option as well. So we went about collaborating with people in Toronto who built websites because we were told that we had to go with them, and building a website where people could actually get a home program that you could do on your own with the support of an exercise physiologist for free. So we'll start out with the community program. So for those of you who are involved with ACE, which is the current program, the Alberta Cancer and Exercise Program, you'll probably recognize parts of this. The community program, based on the protocols that were in the research, so we weren't just pulling this out of our butts, we decided on it being 12 weeks, and it involved 3 different arms. Physical activity, stress reduction, and nutrition. Nutrition definitely lagged behind the other 2, so it wasn't able to get into play until about the last year of it. And it involved educational handouts, because there's actually, as you may or may not be aware, full guides for nutrition and prostate cancer that Prostate Cancer Canada have published with the same researchers that we were actually able to collaborate with to put together our handouts. So the nutrition handouts were meant to be complements to this big guide, and so they were a series of 12 interactive handouts. If you want more information on the nutrition items, if you haven't heard about them before, just chat with me afterwards and I'll be more than happy to share them with you and share the links where you can find them online. Because admittedly, Prostate Cancer Canada hasn't done a great job telling people about it. Stress, yes, Thor.
So would that not be on your website?
It is one of the things on our website as well. Yeah,
Okay.
but it is Prostate Cancer Canada, so there's another place you can go to. Stress reduction was probably one of the more fun arms that we had, because we set about at the very beginning saying, all right, we're going to take a whole bunch of 50, 55, 60, 65-year-old men, and we're going to ask them to do yoga. This will go well. And it actually did go quite well, believe it or not. So yoga is one of the surprisingly well-researched modes of activity for Prostate Cancer Canada, or prostate cancer survivors. Typically, and you may or may not be aware of this already, it is packaged in a very covert form so that you don't know you're doing yoga. So the Strength and Stretch program at Prostate Cancer Center that you might have heard of started as a yoga program called Strength and Stretch because they were worried that men would come to it, which, as we've discovered, is a viable thing to be worried about. We have had people in the past say, well, I'm not doing that girly thing, or we've had people cite religion for not wanting to take part in it. But what it is a low-intensity, stress-reducing activity that has been shown to be wonderful for people's mental and emotional health.
Where is that done?
What's that?
Where is that done? The Strength and Stretch?
Strength and Stretch is the Prostate Cancer Center. The Wednesday class, yeah. Now, further to that, actually, I giggled at this, there's a new program going on at Prostate Cancer Center called Brains and Brawn. It's yoga. But it's good, but it is yoga. Again, marketing it in a way that people will show up, and then once you are there, you're like, oh, this is really nice, I like this. Oh, it's yoga. Well, I'm already here, might as well. And then the final arm, and the one that most people are familiar with, is physical activity. So we wanted to make sure that we could not just run a program, but get some evidence out of it too, so that we could come to healthcare systems and say, look, you know you've heard from us before, and we're here and we say blah, 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 exercise is great, and you nod your heads, and then you just go on, see patients, and forget that we were here. So we want to actually get to the point where we're giving you numbers and giving you recommendations showing that not only is this effective in a lab setting, but it's effective in a community program that you could easily refer to and hopefully support monetarily in your own local community. So we were able to take a look at fitness assessments at baseline in 12 weeks, and as well we were able to look at quality of life questionnaires, which some of you would have been bugged up to 2 years from us for. I promise I'm done. If you've received emails from me, I'm done, it's over. We also wanted to make sure that programs were done in a group setting, Because whether or not people enjoy exercise, we know that exercise works, but we want people to enjoy exercise so that you want to do it away from the program and on your own and forever and ever. And one of the best ways to do that is with your buddies. Because then it turns into a little bit of a locker room experience. You get to have some jokes, get to rib each other, have some giggles. And it brings about not just physical attributes, but it also helps you emotionally as well. And then we also, because we wanted to try to get the full meal deal and make everybody funding the program happy, we also tried to bring in some online resources and interactive trackers as well for people if they were tech savvy to try it as well. That didn't go all that well, but it did inform us in the next wave that we're at right now. So along with that, we wanted to make sure everybody was safe, so everybody went through stringent screening to make sure everybody was going to be cleared for safe, unrestricted physical activity. And as I mentioned, the training of all the professionals made sure that exercises could easily be modified for everybody. Fitness professionals delivered the classes, and the exercises were foundation-based, which meant that they were ones that could be easily applied and you could do on your own outside of the program as well. So people weren't going in there doing Olympic lifts and grunting and doing CrossFit. People were going in there doing things that were less intimidating and things that could easily be done in a majority of different settings. Like I said, they're in a group setting, and all of the instructors followed consistent durations, rests, so that we could make sure that everybody was getting the optimal amount of exercise. Same thing went for the yoga classes. So the instructors were also given extensive training specific to yoga as well, and the classes were designed with an emphasis on pelvic floor and balance. So it wasn't just a random yoga program, it was done with intent and with purpose to address the most common issues seen from men living with prostate cancer. And a point to be mentioned here, the option of 6 to 12 weeks for the program, is basically a way for us that when we went to community partners, we wanted to make the program as flexible as possible so that they found it worth their time to actually implement. We felt like, or if they felt like we were talking at them and we were telling them what to do, in a lot of cases they would shut down. So we wanted to give them resources and then work with them to deliver it in the best way possible for them. We also had educational handouts that presented topics to promote behavior change, get you really thinking about your habits, and how you can make things more enjoyable for yourself so it didn't feel like work. And as I mentioned, the nutrition handouts came around near the end, and these were interactive. They offered different little questions and answers, as well as things like goal setting, those items, as well as a recipe each and every time too. And it was focused very much on an applied side of things. So there's a topic, for example, on food storage or food preparation, as well as taking a look at all the myths or the different items out there that you might have heard, because unlike any other topic out there, nutrition is the one that usually frustrates people the best, because one day something's really good for you and it's fighting prostate cancer, and the next day it's causing prostate cancer. So we had the dietitians go through, they brought the absolute level of knowledge to it, and we were able to put together the handouts to support that. The trainings were done in person and online, and they weren't flash in the pan trainings. They were 12 to 15 hours, and these were with people who already had an existing high level of training. So for the vast majority, university degree plus credentials on top of that. Not everybody was a complete nerd like me and decided to do grad school for no real reason, but they were well educated regardless. And it was again looking at the applied aspects of it. So looking at the background, the prescription, all the way through the class design and management, and then how to screen and modify for each and every individual. And we also left them with resources that would stay as well, so manuals and other items, so that if they ever had a question, they could look it up immediately themselves. And then the online side of things. So we started with a secure portal that people could log into. We tried to get people to do things like questionnaires on that, and that sort of thing on it. Wasn't really a great fit. So we started to try to make it more simple for people. Because as I sort of alluded to earlier, and as you can imagine when you're talking about technology, I was on the phone with people who were around my age, around 30 or younger. And they're throwing all these really cool features and, oh, we can do this for all of your clients. We can do this for all the survivors. I'm like, cool. I don't think they really care. I don't think they really care. What we need is an easy way to log in. Let's focus on the login first. So it was a really big challenge to bring them from these really cool sites that I find overwhelming on the best of days to something that my father-in-law, who will kick his remote control across the room pretty quickly, would feel comfortable doing instead. And so we have settled on in a point now where we are able to provide those free programs for people independently, or if somebody is in a community program, they can also get extra resources on it as well. And the healthcare advocacy. So this is where the transition to where we are now is really starting. We did not get as far with the advocacy as we wanted to when we first set out, mostly because we ran into the same issues that as prostate is, with actually engaging with the physicians and trying to get their attention to let people know about the programming. We were most often shuffled over to the survivorship teams, and our resources would be put in their big library, and maybe once every few months we'd have somebody who took the initiative themselves to actually look us up. So we decided that we need to try to take another different tact here, not only look at it grassroots, but also look at it top down and really try to knock down doors as much as we can. And recently, we finally had a breakthrough. It wasn't us, it was Australia. But recently in Australia, their Clinical Oncology Society, so that's their National Board of Oncologists, which big board, very important in Canada as well. They actually released a position saying that exercise should be, and from this point will be, included as standard care in cancer care, prostate being one of those. So Australia is probably about a decade ahead of us right now, where they actually have exercise physiologists in some clinics, and they have services like telehealth, where people can phone to get exercise advice, or they can go online for exercise advice, and that's just going to be snowballed down there now with more and more individuals coming on board because of the recommendation. And this actually got quite a lot of coverage in Canada as well, with CTV Global, CBC doing spots on it. So we're really trying to leverage this along with the numbers that we're starting to try to publish as well, to really guilt everybody as much as we can so that free programs can be offered to all of you. And again, we're trying to bring multimedia into it. This is going to be another video that I'll just kind of show without the volume going. But it is a video from my supervisor, Dr. Nicole Koulos-Reed, and in it is basically a plea to healthcare professionals on why exercise matters and why it's going to make their lives easier. There is research coming out that integrating exercise in cancer care does the same thing that it does in cardiac rehab. If anybody here has been through cardiac rehab, it's no ifs, ands, or buts. You have to go to a cardiac rehab program where most people get to hop on a bike and you bring yourself back slowly. The reason that that is integrated as being a part of standard care now is because they were able to show how much it cut down on healthcare costs from subsequent cardiac events. We have the same evidence now with cancer, that if people are active, their chance of recurrence can decrease quite a bit, and the amount of follow-ups that people require tend to be less as well. So now we just need to tell people that, because they have so many other things on their mind that it's the last thing they're thinking about. So we're not just targeting oncologists or urologists or radiologists. We're looking at nurses, physical therapists, dietitians, social workers, any member of that healthcare team, because if everybody is aware of it, then somebody is going to tell you about it. So the initial results from the 3 years. So we are currently organizing our different manuscripts, which is a lot more work than I ever thought it would be. So we have about 4, 5, or 6 different manuscripts coming through. So this is the first time we've actually ever presented the numbers to anybody. So keep it quiet, because we haven't even shown Movember yet. So you're the first ones. So over the 3 years, and this is just the 3 years for that initial grant funding, because we're on a 1-year extension grant right now, we were able to get just under 300 men in that we're able to collect data from. The actual raw number, because there were a couple sites in Toronto where we actually weren't able to collect data because of how long ethics would take to get it through, our final number was closer to around the 340 men through. And each of the little green dots represents a community that had a program, and each of the yellow dots represented a community that had what we call a resource kit, which I'll introduce in a second, which meant that they were ready for future programming, but not quite. And this map, as you'll see in a second, has exploded in the last little bit as well. It took place in a number of different facilities, which was exciting for us because it showed the flexibility, whether it was post-secondary institutions, YMCAs, private centers, civic centers like the City of Calgary locations. It seemed to fit in most locations. Different program designs were given, so some places had 2 times a week of fitness, one-time fitness class each week and 1 yoga class each week. Some had 3 classes a week, and others just had 1 class of yoga a week. And most excitedly, this has actually been leveraged, our resources and our programs, in 2 provinces into province-wide initiatives. So in BC, they have the Prostate Cancer Supportive Care Program now that you may or may not have heard of. And exercise is one small component of it, but it's a large initiative at different major urban centers there, giving comprehensive multidisciplinary care for men living with prostate cancer, and that includes exercise professionals in the clinic, referring out to other community programs too. And then in Nova Scotia recently, they've actually been able to get clearance in the Halifax area to pilot the same sort of thing. So exciting times there. And again, goes to show that we were, again, trying to take the work we were doing and really have it apply on that local level. We didn't really care whether the legacy was TrueNTH or not. We just wanted programs to start some way, shape, or form. This is the boring stuff that you probably really don't care about, and that we use to generalize linear mixed model, because I barely understand it. But we looked at the physical outcomes, and we looked at the patient-reported outcomes. So those were the questionnaires that we had individuals like you take a look over. And what we found is we had a pretty representative population, skewing on a little bit of the older side, which did represent a little bit of a limitation of the program, that most facilities are only able to offer classes during the day, which meant that most people had to be retired, which meant they skewed on a little bit of the older side. Or we also ran into a situation we didn't anticipate, where a lot of the younger individuals, and this may be the case for the support group as well, but a lot of the younger survivors didn't really want to be associated with the disease for whatever reason. So instead of wanting to get support from other people, they kind of moved back into the background and said, I'll just take care of it on my own, which was unfortunate, and something that we're hoping we can remedy by being able to offer programs during the day as well as we move on. People with active surveillance joined all the way to treatment completed and 5+ years afterwards. And you name the treatment, we saw it. And we had 1 adverse event the entire time, and that was a vertigo episode. So it wasn't anything serious in terms of related to a chronic condition. They had to sit down for a little bit, and then they were back in a week. We did have some pretty decent data adherence. So we had, out of the 297 people, 246 people actually gave us baseline physical assessments. Less on the questionnaires. A lot of people received the questionnaires and they're like, yeah, I'm good. Fair enough, right on. We expected our numbers not to be great for data adherence because, again, we're in the community setting. So we're giving questionnaires a lot of times to the instructors who are then giving them to all of you, or we're trying to give them over email if we're in a location that is in Calgary. So we knew there was going to be issues with that. So in general, we were decently happy with it. The number I really like to see is the completion status. So 122 people, so 41% of people reported that they were doing something after the 12-week program finished. So they might re-enroll in the program, as it was often the case, or they would enroll in different programs at the location they were at. So if they're at a City of Calgary center, they said, you know what, that was a great 12 weeks, but I think I want to try it on my own, and so I'm going to enroll in a couple of these classes or get a membership, something like that. Other people decided to continue with home-based stuff via the website as well. There were not a lot of dropouts, which was, again, great to see. A few people lost a follow-up, and by that, those are the people just ignored me and started screening my emails, and they're like, oh, no, I'm done with you. 7 people actually told us they were no longer interested, which is great. And again, there was actually only 7 people who had a change in medical status serious enough that they decided that they no longer wanted to continue, which is another really important thing for us, because it shows that there's a good chance that the program itself was at a level that felt doable enough for most individuals that regardless of whether their treatment might have changed, they're feeling really fatigued, they felt like there was something they could do and something they could get out of it, which was fantastic. And so now these are the numbers that we need to show all the docs. So every time you see a P that is equal to a number below 0.05, which is all of these, or else I would not be showing them to you, those are the important findings. These are the ones where we saw a significant change. So quality of life. So in general, anybody who participated in the program, their quality of life improved over that 12 weeks. This is just 12 weeks. We haven't taken a look at the 24 weeks or 1 year just yet. Everybody's physical activity level tended to increase. Something that isn't shown here that is also important to note, we were able to see that people who were sedentary when they started, so people who were getting 30 minutes of activity a week, really not that much, they were actually exceeding the recommended amount of activity, which is 150 minutes a week, by the end of it. And you can't account for that with just the classes, since the average attendance was about once a week. So people were going out and doing things on their own. Body composition, not something we expected to see, but people's BMI and waist circumference did improve. So especially for men who are on ADT, what the research shows is that you're kind of fighting a losing battle, and without being active and watching your diet, you're likely to gain weight. So a good goal is to maintain where you're at and try to hover as best you can there, and that's great. And it's something that we really try to empower people with, because it can be really frustrating when you're doing work and you're just kind of staying there, but that's fantastic to see. That's what you would expect. We actually saw a little bit of a reduction in both BMI and waist circumference, which was wonderful and something that isn't always seen in a lot of the literature. Increase in muscle strength, increase in muscular endurance, both lower body and upper body. So for those of you who did do the program, whenever I would say, all right, it's push-up test time, people look like I'm going to kick you in different places, Mike. But the push-ups turned out to be an improvement. Again, we're not talking about making people buff or making people feel like they are a new person. We're trying to get you feeling back like yourself. So as an example, the push-ups went from an average of, this is a generous average of around 4 or 5 to 6 or 7. It's an increase. It's fantastic to see, but we're not asking or expecting people to be crunching out 20, 30 push-ups at any given point. Aerobic capacity, very important one, increased over that 12 weeks. And that was a 6-minute walk test, so the distance somebody could walk over 6 minutes increased substantially. And that one's important because it's an important outcome for physicians. As well, the 8-foot timed up and go on the far bottom right, that's the amount of time it takes somebody to stand up, go around a pylon, and come back and sit back down. Very simplistic test. Most people roll their eyes at it, but believe it or not, it's an extremely important clinical test for a lot of physicians, and so they take notice of that. That's a representative of fall risk. So if somebody's able to do that a little bit faster, the risk of imbalance and the risk of falling decreases. We also were fortunate enough with, and again, a couple people in this room were able to participate. We were able to hold a focus group, which turned out to be invaluable. So we had, I think, 12 men in total come in 2 different groups. And we asked them about their experience with the program, their value of exercise, and gave them an opportunity to tell us what they wanted to do differently and how they thought the program should improve. Because it's important for us not to talk at people and not to say, this is what the research says, you have to do this. It's a give and take. We also want to make sure that the people who are actually doing the programming get a say in it, and we're listening as well. And so what we're able to find is that the program seemed to facilitate activity for a few different reasons. The fact that it was in the community seemed to matter to attendees. The fact that the instructors were trained and knowledgeable. The fact that the classes were free to start, which is an important thing for us to tell funding agencies. And the classes were varied. And the fact that they were done with fellow survivors. It was kind of split half and half. Some people felt that they wanted to hang out with just other guys, and others felt having support people was important, or just having other survivors, didn't matter what the background was, that would also be just fine for them as well. We got everybody's say on the individual benefits of the program. Again, people said that they felt the improved fitness, the improved energy, weight loss, or people said they were able to better handle and cope with diagnosis and treatment, which is exceptionally important and isn't our #1 goal when we go in with a program like this, but it's wonderful to have that as an outcome. It helped people get over a sedentary lifestyle where your default is getting home and sitting on the couch. And it people came away with a camaraderie, an understanding, and a sense of friendship, fellowship, and teamwork throughout it as well. With improvements in sustainability, there's a couple logistical improvements, increased emphasis on nutrition, for example, scrapping the website in favor of a simpler website, which I got to say, hey, we're on it, I get it. And what came across very clearly and very passionately from all of you was that people wanted to see programs be a part of standard care, whether that was going to be paid for by the government or by insurance companies. It should be paid for by somebody. And that goes along with those position statements and position stances you see now coming across from different countries. So as we're writing our manuscripts, we're going to take a look at some conclusions that yes, community-based programs are feasible, which is something we didn't really know about beforehand. It was kind of touch and go, whether you gave a program to an organization, whether they would actually be effective or not. There's always going to be different issues to overcome with recruitment, attendance, but there's going to be positive things like low adverse events and pretty good adherence. And then in the future, we are still looking at the economics of the program, so we can have those money numbers for the physicians, and we can tell them this is how much participating in a program that on average costs about $200 per person. This is how much it's going to take off the healthcare system. You can imagine $200 usually equates to about a single appointment with a professional in some manner. So it can definitely pay off for them in the long run. And we did get an extension grant over the last year with a mandate from Movember Prostate Cancer Canada to improve the online delivery. Because what Movember is looking for is a little counterintuitive to what we were trying to do, where we were trying to deliver things in a local capacity. They were trying to deliver things in a global capacity, so everything looks the same. They now realize that that's a little flawed because every country looks a little bit different. But we have been able to devote some time to trying to make that website a little bit more user-friendly so that people will feel like they can do things at home, whether they're in a community program or not. The other item we were able to do is continue delivering those resource kits that I mentioned to you. So each of the resource kits is basically a big chunky binder along with a huge USB, I think 16 gig USB, and it's full of basically all the resources we created. So it's meant to be a program in a box where an organization can take this, they have all the resources they need to start a program. They can start running. There's a few excuses for them to drag their heels on a logistical or facilitator issues, and they can get going. We're also be able to provide training for free to any of their facilitators as well. So this is what I spend most of my day doing right now, is being on the phone, going on emails, and trying to advocate for places as far away as St. John's from my desk in Calgary. And we've had some pretty good success with it. So out of the 90 major municipalities across Canada, we now have some sort of representation. I believe the last count was in 69 of them, 68 of them. And we're on track to have it in likely about 80 to 85 of them in the next couple months. Which means there might not be a program in place in a location right now, but there's a good potential that there could be at some point. Most of those programs are fee-based. So we've given them cost recovery models so they can keep the costs as low as possible. And we've given them ways to try to get local funding. And we've also, as I mentioned, been able to have the resources offshoot into sustainable regional programs. So in Alberta, there's the ACE program, which is not prostate cancer specific, it's all cancer survivors. But again, it's an exercise and physical activity program that prostate cancer survivors can access, which is important. The website was simplified and continues to be simplified, and there's plans for a pilot, basically a pilot focus group for people to come in, log in for the first time and go through it and have some fun on it and tell me what they think about it, whether it's good or bad. I'll cower in a corner if it's bad. And we tried to make the registration easier, and basically the idea behind the website now is all the bells and whistles are gone. It's now what we call a triaging site. So what our grandiose plan is we have prescription pads, like this guy, that we worked with some physicians and Exercise Medicine Canada on putting together. And basically it is the very bare minimum that you could find in a prescription pad so that the doctor has to do zero work. Essentially, they put your name on it, they sign it, and from what we've seen in the research, as soon as you do that, it makes all of us feel a little bit more guilty. And we're like, oh, the doctor signed it, I guess I should probably look into this. And so it's meant to bring you to the website, or if you're like, I'm not going right to the website, I'm just going to email you and you help me. Super, no problem. It sends you right to us, and then the website lists the community programs for you. So all you have to say is I'm from Alberta. It'll list the Alberta programs. You find the one closest to you, and it has the contact info. And you're able to contact that location right away. Or if you don't see a location for you, or if you don't want to do a community program, it'll walk you through how to register for the free online programs as well.
Can you get the nutrition guide online at the same website?
Yeah.
Just go for that?
Yeah. There's that. You can also get it open without actually having to register though too. So these are some of the different items on the website. So there are trackers where we're actually able to give you a personalized resistance training program. It is from an exercise physiologist. It's I'm a one-man crew. I do everything, so I advocate and I'm actually doing the programming too. So that program is based on your needs and your background. So it's, again, going to be something that you're collaboratively working with. There's also programs if you don't ever want to deal with me. There are some basic introductory programs on there where you don't actually ever have to talk to anybody. You can just go for it right from there. All the trackers also sync with wearable technology as well. So if you have a Fitbit or anything like that, I know some people are wearing those, you're able to sync it and it'll actually track your steps on the website here. And you can actually put down how you're doing. You can also track things like blood pressure, heart rate, if you're into that sort of thing as well. You saw that there's demo videos for each exercise as well as photos. There again is a celebrity aspect to it with somebody in this room. It's two people in this room actually being demos for it. And then there are the resources, like I mentioned. So there's actually little workbooks that they're called. So over 12 weeks, you can access each of these educational resources, and it shows you a little bit on different topics here or there. And it also has a health library. So the health library, for lack of a better term, is we did the Google search for you, because we know the internet can be an extremely overwhelming and frustrating place at the best of times. So instead of you Googling prostate cancer and tomatoes, I wonder what's going to come around. We were able to go through all of the searches. We're able to find the hits and the resources that we know are evidence-based. We know they're correct. They're not coming from somebody's basement. They're coming from qualified organizations. And we're able to post this in this extensive library so that you can search for it there instead. And you know that the answers you're finding are going to be the appropriate ones. And you're not left guessing like you might otherwise. Like I said, you can, if you are somebody who likes to be A-type, you can track different things on a weekly, daily, monthly basis. And you can sync. Right now, for example, I'm working with somebody from out east who is part of the armed forces, and we've taken him from just outside of his prostatectomy because he was a younger guy, and we've got him now to the point, well, I say that he's gotten himself, he gets full credit for it, he's gotten himself to a point where he's now passed all of his physical tests all over again while having a newborn baby. So he is somebody who was very comfortable with the technology and comfortable with exercise, so that it might not be as easy for anybody else, but there is, again, a flexibility with it so that you can get out of it what you want. And as I mentioned, we're still going to be further evaluating the program. So right now we've looked, this is the model that we're using, it's called REAIM. So far we've looked at reach and effectiveness. So are we getting the proper demographic, or are we forgetting a subset of survivors? Yes, we were able to see that we're not getting younger men. How can we engage with younger men a little bit better? Referral sources. Most of our referrals came from support groups. Fantastic. How can we make sure that we get more support for those support groups by giving the nudge, nudge, wink, wink whenever we're talking to cancer care foundations? And how can we make sure that we're also using the cancer care centers themselves as a referral source too? Look at the effectiveness, that yes, this program is effective. How is it not as effective? And can we improve in different areas? And now we're into the adoption and implementation. So what programs are being adopted? How are they being implemented? So now we're following up with the different programs and seeing exactly what they look like, because most of them have adapted them to their needs, or they've identified weaknesses we didn't. And so we want to know those. We don't have an ego about it. If they found something else that worked better, super. We want to talk to them about it. So now we get to the actual hands-on, what's available to you. You've likely heard these spiels before, because I know colleagues of mine come in every once in a while. But in Alberta, as I mentioned, we were very fortunate that TrueNTH, pretty much the timing worked out beautifully. As soon as the Movember money ran out, ACE came into play, and that is funded by someone in Alberta. I want to say Alberta Innovates, some grant, some big grant. I should know this, but I don't. And it is for newly diagnosed individuals, so people who are up to 3 years post-treatment. And treatment can include pretty much anything. So hormone therapy, chemo, radiation, surgery. Again, same structure as you saw with TrueNTH. The one caveat being, there is no yoga. So it's 2 times a week of fitness. So if you want your yoga fix, what we're doing is we're actually putting yoga videos on the website. So it's our main instructor, Tyler Arneson, and she's giving home yoga instructions so you can follow along with her from home. Or we encourage you to take advantage of yoga programs in your community, because this city is now flooded with instructors who have training with cancer and exercise. It's at multiple locations, and again, its goal is to show people that exercise should be a part of standard care. These are all the different locations that you can find it in. So not only is it at the City of Calgary, it's at both Wellsprings, if you're familiar with Wellspring. It's at the Holy Cross campus downtown. The YMCA way deep south there by Okotoks. Can you tell I live in Tuscany? I'm only a little bitter about having to drive down there every once in a while. And there's the UFC Thrive Center in the northwest there on campus. If you're not familiar with the Thrive Center, it's a free workout facility for survivors. So general public don't get access into there. It's supervised by kinesiology students who are trained, and it's open for as long as you want it to be in terms of you being eligible. So as soon as you're diagnosed, you can go to it for as long as you want after the fact. The only caveat again is that the free parking is a little bit off campus, so it's about a 5-10 minute walk. And they won't give us free parking on campus, but otherwise it's a free option for everybody. If you are somebody who's on hormone therapy, there is a study as well going on right now that is looking at what the most effective mode of delivery is. So TrueNTH, as I alluded to, we have community programming and we have home programming. The study for men on hormone therapy, they want to decide which one might be slightly better than the other one, knowing that they both work. Again, looking for that number on what's going to be most cost effective. So what the study is looking at is randomizing. So if you sign up, you're like, okay, I'm in. A computer will tell you which one you're in, whether you're in group or home. And then you go through that one. The home one is telehealth. So if you have an exercise physiologist who will go over the phone with you about once a week to make sure you feel supported. You get a program via some digital resources, and you're followed that way for 6 months. And the group is pretty much what we just went over. So it's, except it's 3 times a week, but again, it's a group of just prostate cancer survivors. Your eligibilities, you have to be on ADT within the last 6 months and not regularly active, and you're currently experiencing fatigue. The other item that I'd be remiss if I didn't talk about is the Prostate Cancer Center program. So that's Strength and Stretch and Brains and Brawn and Brain. I don't remember which one it is. But again, both of those programs are by trained exercise physiologist and a yoga instructor, and being right at the Prostate Cancer Center in that conference room that you've probably been in at some point in your lives. So that's where we're at right now. We are in talks to try to, again, further extend our grants so that we can continue spreading it across Canada and advocating to get that big pie in the sky where it's recommended that it is a part of standard care. And each and every one of you will get a chance to see an exercise professional to get a program that you'll enjoy and get active in things that you'll enjoy and have all your questions answered as soon as you're diagnosed or well after as well. So thank you everybody for having me today, and if you have any questions, I'm more than happy to answer them right now.
The ACE program slide, it said it was limited to 3-year post-cancer treatment.
Yes.
So what happens after 3 years? Are you meant to be on your own?
With any sort of grant-funded program, they gave us a cutoff to make sure that we were able to, how did they put it? To address the people who were likely having the highest amount of symptoms, or side effects, I should say. So after the 3 years, there are maintenance programs also involved with ACE, but then the program is no longer funded for that first 12 weeks. So it's just like the TrueNTH model was, so the first 12 weeks is funded, and then after that it's a fee-based service. So I don't know what the fee is, I think it's...
I see. So what you're saying is that...
150, I think?
That it's a kind of a free program if it's within 3 years, but you can still sign up and pay for it after the 3 years.
Correct.
Okay, so they're misleading.
Yeah. Yeah, and it's only for that first 12 weeks, and then maintenance afterwards you have to pay. Yes?
Mike, you made a comment that you've got a lot of referrals from support groups into your program versus the clinically driven services. I hope that you have enough of data that you would be able to write a publication that basically would address that, in the sense that the medical community is cultured in its own way to not refer to organizations and agencies and groups such as ours, or maybe such as your exercise program. Get that into some kind of document that is reviewed, shows good data, and put it out in the literature. Because
the thing I've enjoyed most about being a part of this project is I've struggled my whole life with ego issues on the other side of things. I mean, look at me, I'm a very diminutive person. I don't really understand why people get caught up with a lot of this politics, and the amount of time that we've had people ask me like, well, are you sure we can use these resources? Like, what's the catch? Like, do we have to pay? We're like, no, take them, please. The joy for me has been being able to advocate in little passive aggressive fashions for not just the program, but for supportive resources as a whole. And the number one has been support groups, because that whole survivorship arm is meant to be delivered together in that multidisciplinary fashion. And that is something that we're already trying to get across in a paper, and that we put in to most presentation that we've given. TrueNTH, it's like the whole TrueNTH was meant to be that, where exercise was, and lifestyle management was one arm of it, and there was meant to be a peer support side of it, there was meant to be ADT support, bowel support, sexual education support, all throughout the whole thing. What I think they failed to realize is that a lot of those things already existed. And the three items that kind of saw the most benefit was the lifestyle management, so what we were doing, ADT management, and the sexual health, because those three things didn't exist on the same level, but things like the peer support, they didn't, I don't believe they actually funded it beyond the initial one, because they're like, oh, look, it already exists with all the support groups. And so I think that they've learned some lessons as they went along about the value of it, which is why we've went out of our way to try to use different avenues, not just for us, but in a symbiotic way as well. So trying to get a cancer clinic individual to say, hey, yeah, we'd like you to get active, but then that program that we're running in that community, one of the first things that they give individuals is information on the support group if they don't know about it already as well. So that there's that give and take, so that they're able to get some of it as well. And that's actually a lesson we learned here locally too. It didn't really work out as well as we wanted it to, because most people were coming from here off the bat. But we did at different times I know I gave Dave's card out a few times to try to get people going back and forth, and people were told about it as a resource at different points by the instructors too. I agree.
One other question. At one point earlier on in your presentation, I think you inferred that prostate cancer patients are different to other cancer.
Oh yes, I didn't come back to that one. That's right. That's right.
Tell us.
Yes, thank you.
How are we doing?
So this goes back to the focus group. I missed that. Thank you. So the interesting thing that I've always been told my whole life as an exercise professional, because I'm also a behavior change professional, basically I'm trained to try to manipulate your thoughts. So that you'll actually take action on your own and you feel like it's your own idea, because it is your own idea. And then I sit back and be like, oh my God, look at the theory working. The one thing we've been told is this idea of a teachable moment, which you might be familiar with or not. Essentially, the teachable moment is the idea that at an important point in somebody's life when they've been delivered life-changing news, like a diagnosis, that is when we as a species tend to take the most care in our health, and we tend to take action at that moment. That's our eye-opening moment where we're like, okay, things have to change, let's get to it. Now, I'm a 31-year-old man. I'm sure a lot of the women here can attest to this as well. It's not always that quick for us to change our minds. Something big might have happened, and we're like, oh, cool. Okay. Is the game on? And it's something we always joked about, but then it came across very clearly in the focus groups that almost unanimously, actually it was unanimous, everybody there agreed that they needed a cooling off period. When that diagnosis and even when that treatment was going on, it wasn't like, I want to take advantage of this, I want to make sure that I do everything for myself as I can. There was a woe is me moment. There was almost like the man cold idea, where it's like, you're like, oh, I'm done. Just please give or help me in any way you can. I'm just going to sit on the couch. That was almost the idea, where it was, I need some time to process this, understand what's going on. I'm not going to take action over anything right now. I will get back to you when I'm ready. And that's not something that they're traditionally used to hearing. And this is just strictly me speculating, but most of the research has been done with female-related diseases, specifically breast cancer, where that absolutely is a phenomenon. And a lot of other chronic diseases as well. It tends to be, if it's not female-dominated, it's maybe a younger population. So like diabetes or cardiac, or it's something with a cardiac issue where if you've had a heart attack, that's jarring, right? So it could be any number of different reasons, and it's something that we've strongly recommended that we try to get a PhD student or somebody to come in and take a look at in a little bit more detail, because it's not much in the research right now. But it's something that's a great example of something that isn't in the research, but we need to take a good long look at our approach to asking or to informing people to get active. So that prescription pad, for example, we're not recommending to give out immediately right off the bat. We're trying to get this into the hands of a lot of the supportive care individuals, nurse navigators, physios, or urologists, oncologists at a follow-up appointment. Because that's the time where a lot of the big items are a little bit in the rearview mirror, and you can kind of look ahead, and you've had time to process, and then, okay, hey, there's something you can take advantage of. Or telling individuals about it at a second time as well. I told you about this the first time, you might not have done anything with it, but this might be the time for you now. So really communicating to healthcare professionals that there's no one opportune moment that people can get active. It can be beneficial at any point. And so therefore, nobody who has ever diagnosed needs to feel bad about not wanting to do something immediately. That's your own prerogative. Totally understandable. Everybody deals with that in a different fashion. And the healthcare system and the referral patterns have to be set up with that in mind instead of fighting against it, which it does right now.
Yeah. So what can we do to help you?
It's the groundswell. So every time, we're asking every time somebody sees a physician, quiz them. Hey, what are my exercise options? Again, in Alberta, there's a separate initiative, has nothing to do with simply with cancer, but we're collaborating with them. It's called Prescription to Get Active. And that's essentially their mandate. So what they've done is they partner with most of the same facilities we have, like the City of Calgary. And their goal is to get people to go to their GP, say, hey doc, I'd like to get active. I heard there might be a little deal out there for me. And the physician gives them this prescription to get active, and it's good for, let's say, a month free at a facility to get somebody in the door. It's meant that the physician gives it to that person, and the physician brings it up and gets them active. But they've had the same sort of look that we've had, where we need to work top down and grass floor up. And so we're trying to get anyone and everyone, as often as you can, chat with your physician, your care team, be like, hey, why haven't you ever mentioned exercise to me before? Seems like a weird thing. Did you know that there are options out there? And then you're priming them for when we're contacting them on an extremely regular basis, to the point that they hate me.
As the child you wish you had, how can you help us?
Say that again?
As the child you wish you had, like we're one of those pods of the 5 things you wanted to do or the 6 things you wanted to do was the peer support system.
Yes.
So how can you help us systemize that approach versus just occasionally handing a card here or there? How do you think, what have you imagined that the relationship could be developed to?
That is going to be very dependent on what we're allowed to do with our next grant. But we've been able to, if I can be candid, we've been having to do this pretty individually at this point, which was not the intent. The intent was for all the TrueNTH different arms to work together with Prostate Cancer Canada, but Prostate Cancer Canada hasn't been able to have the personnel to give us a whole lot of help with it. So basically what we've been restricted to at this point is constant communication with your presidents and your executive directors across Canada. And so in the pockets that have very organized organizations like yours, you see lots of success. ACE would not exist if it hadn't been for the involvement of all of you in this room. And so you're seeing the payoff already with something like that here in Alberta. Same thing happened in BC, they were very organized. But then you have, ironically, a place like Ontario, Southern Ontario. It's so scattered, everybody does their own thing, and there's not a lot of footholds being gathered on it. So what we imagine is being able to get contacts at the Cancer Care Center and then being able to meet with those administrators and those facilitators as a united front. So essentially we have pathways that we're able to present to them saying, okay, these are the survivorship resources available to all of your patients. This is, maybe there's 1, 2, or 3 of these types of things. You are giving them to your patient, and then they're able to access these places, and then these places in turn are also recommending that they're constantly being able to access your survivorship resources as well. Because that's the thing, is every place has a library, a survivorship library, that they're always complaining to me that's never getting used. And so we're trying to, again, have that pass back and forth where they're providing information on what we're doing, support groups, exercise aspects, you name it, and then those organizations are able to continually mention to them that they can go back. And again, PCCN here is a great example of it, because I know I've heard anecdotally from these gentlemen that there's been several younger people that went through the program that actually had never heard of the Prostate Cancer Center. And then they got involved with Prostate here, and then they heard about the Prostate Cancer Center, because they had never received surgery. They just received radiation and never had actually been sent there. And knowing that, the Prostate Cancer Center was actually able to do something similar to what you're suggesting right now, where they were able to coincide and work with the clinic so that even people from Tom Baker were told about them at some point, so that there was less of a burden on prostate. But by being sent to Prostate Cancer Center, then there was a better chance of them being told about prostate as well. So it's basically, it's taking that web and bringing it down into a simple one-stop shop, which is what we're trying to do.
Those two classes we do exclude yoga. You offer a yoga program somewhere in this.
Yes.
Is that still on offer? Is that still available?
Yoga Thrive is still available. It's not prostate specific, but Yoga Thrive is still around. That's yoga for all cancer survivors.
And how do people get access to sign up for that?
So there's cards on the table over there for you if you want. Otherwise, this is the number. If you phone this number, you get access to all of our programs. So phone the number, say I want info on Yoga Thrive, and they'll pull up the info for Yoga Thrive. The first one, 210-8482. Yeah.
Okay, Mike, I hate to give you the
No,
hook
thank you.
because I always
Thank you.
learn something
That's good.
new every
That's
time
good.
you're out. So we appreciate you taking
Thank
the
you for
time and
having
sharing
me.
with us. It's always good, and it's good to see those results because, as you know, I was part of that program and answered some of those questionnaires. So it's nice to see that the information produced such favorable results. And I look forward to seeing what you're going to do with the next grant.
We'll keep you guys in the loop.
Yep, excellent. Good, thank you, everyone.
Thank you.